We're right around 40,000 new cases. That's an unacceptably high baseline. We've got to get it down. I'd like to see it 10,000 or less, hopefully less. The issue that we're facing right now is we're entering in a day or two right now into the Labor Day weekend. And we know from prior experience that when you get into holiday weekends, the 4th of July, Memorial Day, there's a tendency of people to be careless somewhat with regard to the public health measures that we keep recommending over and over again. So I really want to use this opportunity almost to have a plea to the people in this country to realize that we really still need to get our arms around this and to suppress these types of surges that we've seen.
Our numbers are great. The stock market is essentially at an all-time record. If you would have told me this, I think we're rounding the turn on this China virus. We're rounding the turn. Vaccines are happening. Therapeutics are happening. You look at the statistics, they're really good. But we're rounding, even without that, we're rounding the turn. We're going to have a phenomenal quarter. This quarter is going to be really good.
This is a guy who kept saying it was going to go away. This is a guy who told African-American ministers, I think at the end of February, this is going to go away like magic. Just believe me, it's going to go away like magic. He told senators, Republican senators in early March, don't worry about this. It's going to go away. Yeah, we've got it taken care of. We're doing a great job. He also, of course, said it was going to go away magically in April when things began to warm up. Since that time, since he made those guarantees not to worry, he was asked, actually, if he was worried about it in early March. He said, no, I'm not worried at all. Since that time when the president said he wasn't worried at all, look at the bottom right-hand side of your screen. That's how many of your fellow Americans have died of the coronavirus since Donald Trump made those guarantees. He continued to make those guarantees in the summer. He's still making those guarantees
still having these
as we
super
move to the
spreader
fall.
events.
And he's still having super spreader events. Yesterday, he had a super spreader event in North Carolina.
I mean, look at this. And he also got up on stage and spoke to a crowd. And these people, some are wearing masks, but I see a lot of people clustered together without wearing masks. And that is alongside Dr. Anthony Fauci saying that the numbers in certain areas of this country are at unacceptable levels. That is a polar opposite description of the situation. No. Joining us now, pulmonologist and NBC News medical contributor, Dr. Vin Gupta.
So Dr. Gupta, you know, I know this is impossible for Donald Trump to do, but let's try to take this out of the realm of politics just for a minute. I know he can't do that, but we have to do that. For some time, doctors have been warning. You've been warning. Epidemiologists have been warning. Dr. Fauci's been warning about the fall and the dangers of what could happen in the fall when the flu season collides with the coronavirus. And you have Donald Trump still going around pushing, getting the government to push treatments that end up being ineffective or certainly not tested. And now we have this bizarre announcement that states are being told to get ready to distribute a vaccine by early November. This would be a vaccine, of course, it's not going through all the proper stages, that won't be adequately tested. And I wonder what doctors are going to recommend to their patients that even if they're big proponents of vaccines, that they can trust this vaccine that Donald Trump and the FDA are talking about rushing to market.
Joe, you're talking about a timeline that's less than 8 weeks away. We're already in the beginning of September. And so a vaccine that has to get mass distributed and then into people's arms by the beginning of November, late October, that needs to start happening in a matter of weeks. And Joe, there isn't a single company there that exists right now that has a clinical trial, a phase 3 trial, where tens of thousands of people are getting this vaccine. Scientists are examining it for health and safety impacts. Nobody's close to the ideal target. And this notion that we're going to have in 8 weeks this ready-made vaccine. To your point, Joe, what people want, they want an expert review panel that's apolitical, that's composed of vaccine experts to look at the data, to give it a go, no-go. That's what people are looking for, myself, my colleagues. Without that, there's no trust. This is only going to embolden the anti-vaxxers out there, those who don't believe in vaccines at baseline, like the flu vaccine. This is going to give them more fodder. But right now, trust is an all-time low about any vaccine. And last thing, what I will say is, it's not just one dose, Joe. We're thinking we need 2 doses. They had an initial dose and a booster dose. So that's 650 million doses of this vaccine, not just 325.
Yeah, and Sam Stein, how ironic that you actually have people like Anthony Fauci who are talking caution, saying, hey, we've got to do this the right way. We've got to do the testing the right way. And Anthony Fauci is the very guy that anti-vaxxers and also conspiracy theorists who, of course, breed on Facebook, they've been attacking Fauci because he was going to try to make billions of dollars on he and Gates and whatever conspiracy theorists, the cabal in this pandemic, they were going to make all of this money by getting rich off of vaccines. It ends up that it's people like Anthony Fauci that are urging caution, while Donald Trump is the one trying to rush something to the American people that won't go through its proper trials, that can't be guaranteed as being safe. Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.